Okay, so day 2 after my LASIK eye surgery at the Manchester Royal Eye Hospital. It's the 11th of January. I had it on the 9th of January at about 4 o'clock in the afternoon. I'll try and keep this as brief as possible. When I was doing my research, all I really managed to find was loads of negative stuff that people have put up, but my experience has been absolutely fine. So yeah, day of the surgery, I pitched up. The Dr. Brahma, who was my surgeon and was absolutely fantastic with me from start to finish. He took me into a room where he went through the consent form with me again. He thoroughly went through the risks that are part and parcel of laser eye surgery. He ensured that I understood all the risks, which I did thoroughly. Asked me if I had any questions. I had a couple, which he answered to my satisfaction. I then signed the consent form, and nurse came in, cleaned around my eyes, put like a hairnet thing on to keep my hair back off my face, taped it down, cleaned my eyes and my eyelids, and applied some anaesthetic drops. I then went into the surgery room, and they offered to hold my hand, which I took them up on. I've never been so scared in my life, like shaking head to toe, on a scale of 1 to 10 for nerves. Yeah, I was definitely weighing in at a 10. So the first part, they laid me down on this bed, put like a nice comfy cushion under my knees, and your head kind of goes into a cup thing, so it's more level with your body as opposed to being raised naturally above your body. They then put a bit of tape over my right eye and moved me underneath the first machine, which makes the flap on the eye. No pain at all. Dr. Brahma, he put drops in. He carried on putting drops in, which comforted me. I probably didn't even need them, but it gave me more comfort. Then the procedure started. The only thing you do feel is a bit of pressure. What he did first was he put a suction cup onto my eye, and you do feel the pressure. It's not unbearable. It's just it's just pressure. It's just unnatural. It's an unnatural feeling, but it's certainly not sore. Just a bit uncomfortable. You're focusing on 2 rings of lights, bigger one outside, inner ones. If you think of the bottom of the spaceship in Close Encounters, it's a bit like that. They start to come closer, and that's the suction going onto your eye so that it can, so the laser can come across and create the flap. Didn't feel a thing. You will lose your vision at this point, so don't let that scare you, but your vision will go. Mine went quite hazy, black and white. It's kind of like I was looking through a really, really dirty window. And then over to the right eye, again they take down the other eye. I think all in all, this part of the procedure took maybe 4 minutes. Again, the discomfort with the pressure being placed on the eye, but not unbearable. In fact, anything, there was a little bit of pressure on my nose that was causing the most discomfort from the angle of the machine, I guess. So that's the flaps created. I then swung me over to the other machine, had I not have asked, I wouldn't have even known that at this point there was a metal clamp being put into my eye, but I didn't feel a thing. It was only because I was speaking to Dr. Bowman, asking him to talked me through the whole procedure. You can see like the small little scalpel like hook thing as they as the doctor pulled back the flap, which is it may gross some people out, but by this point I just found the whole thing quite interesting. And there's like this really bizarre, crazy snowflake. I guess it's like the craziest, reddest snowflake you'll ever see, and you're pretty transfixed by it. And at first I didn't even realise that was the laser. I was expecting a small red dot. And the next thing, it just starts going crazy, making this hissing, popping, crackling kind of noise. And next thing, and it changes colour. It kind of changed from like real vibrant red to an orange, to a vibrant orange, back to a red, and then you smell something that smells like burning hair. Some people will say that you don't smell anything. They might not have, but I did. I smelled burning hair, and it lasted a couple of seconds, but that's your cornea being burnt. But you know what else are you going to expect? And that took about 4 seconds. I thought that it was going to be on my eye for a lot longer, but my initial consultation was with another company who I eventually didn't go with. So there were differences in the equipment that they used that I didn't ask about. So yeah, then onto the other eye, same thing, zapped it. Again, about 4 seconds or so. My prescription, by the way, was -3. So if some people, different prescriptions just can take different length of time to zap it. And then took the clamps out and sit up slowly as well, because I was feeling really lightheaded, really weird, and what I didn't realise is that that's your adrenaline, and it does you feel really spaced out and not with it, but it's purely your adrenaline, and the fact that you've been laid at an angle and your head's been down in a cup, so you've had time for your blood to rush to your head, but all in all, 10 minutes in and out. So I had a quick, Dr. Palmer had a quick look at my eyes, and he was happy with the outcome. And then went in with the nurse. I was in with the nurse for about 10 minutes while she was explaining the different types of drops that you need to put in. And she put my plastic eye guards on. And then I left, and I went straight to a hotel, which was conveniently right opposite the hospital. I would suggest that you get accommodation as close to the hospital as possible, or whichever clinic, or get home as soon as you can, because within about 10 minutes after being in my hotel room, my eyes were stinging like a bastard. You imagine chopping the strongest onions ever, rubbing a bit of it into your eye, stick a chili in for good times. That's what it feels like. For me, anyway, that was my experience of the after pain. Stinging, really stinging. My right eye, I was getting shooting pains down intermittently, which would really catch off guard. You can't flower it up. It's sore. It hurts. For me, it lasted around 4 hours. So come about 9:30 in the evening. My eyes were feeling a lot better. But I took a sleeping tablet, which the hospital had provided me with, and take my eye guards down and slept through till about 7 o'clock the next morning. At which point I woke up and wow, so excited. I could see it was great. I reached straight for the TV remote, switched telly on, could actually see telly, which was brilliant. Another thing as well, during the whole pain process afterwards, your eyes are going to stream, they're going to water a lot, so I have a lot of tissues within close range. But just close your eyes and try to sleep. It's difficult because you're in a lot of pain, but try and sleep. Take the painkillers, and just bear through it. Just bear through it because it does get better, but it does hurt. So since then, a little bit of redness, kind of around the eye, maybe up top there. On this one, not so much. No. Oh yeah, a little bit there. That's kind of where the pain's coming. So you see that. So I imagine that's more bruising. Any bruise, you touch it, it's going to hurt. So I imagine that's where the stabbing pain's coming from, which I still get. But I'm only 2 days down. Been using my drops religiously. Keep your hands nice and clean. Keep doing a sanitary environment. Just minimise the risk of any infection. Sleep with my guards on. After pain, none really. For me, it feels like I've got a gritty, dirty contact lens in, but minimal pain. Irritation. I've been at work today. I couldn't go to work yesterday, so I was still in Manchester, and I needed to travel back in the evening. I live in Guernsey, but had I been in Guernsey yesterday, I probably would have gone to work. Went to work today. Air condition, was a bit of a pain in the arse, but just used the drops and it was fine. Other than that, starburst, got starburst, halos, more smudges than halos, but I had that before. I had starburst when I was wearing glasses, and not to the extent I've got them now, but when I say not to the extent I've got them now, it's not like they're crazy. I managed to drive to work this morning. It was still dark, lights were on. Yeah, it's a bit mental, but it's manageable, and I imagine with time that they will, they'll just get better. Smudges, I didn't have them before, but I have them now. But they're just there. That doesn't bother me. They're just there. Then the main thing is that I can see. My vision as a whole is goes in and out. 1 minute it's pretty good. Like now, now it's pretty cool. When I got to work first thing this morning, everything looked like it had like a layer of mist over it, and that's just kind of how it's been all day, kind of in and out. But it's in reality, doctors told me you're looking at 6 months before you're completely stable with your prescription, with your eyesight, and I'm not expecting anything other than that. But best decision I ever made. And I would, sorry, my cat's just jumped on the table. And I'd recommend it to anyone. So if you're going to have it done, good luck. It's life-changing. It's worth every penny.